Hello, I'm Dr. Sita from Sita Lakshmi from Hyderabad, Ojas Aesthetic, and we are going live today. And here we want to discuss one of the very much known topic for everybody, that is PCOS. What is PCOS? It is polycystic ovarian syndrome. Previously, we all know that we always used to call it polycystic ovarian disease. Of late, because of the many symptoms involved in that and many other criteria, it is broadly classified as polycystic ovarian syndrome. And most of the women do complain, and they also self diagnose themselves, telling that we have polycystic ovarian disease. What is this and where is it seen? According to the incidence, around 6 to 18% of the women all of the world suffer from this disease, and I should say syndrome, and usually starts after puberty, just after puberty or a few years after the puberty, and late runs into late 20s or 25s also. So when in puberty, we always see women or young teens coming with lot of acne most of the time, or some other symptoms which are always disturbing. Most of the time, this was a forte of gynecology because the menstrual irregularities were the prominent ones that are sought after because of the irregular periods or the changes in the cycles. Most often, the diagnosis was lying in the gynecology. Now, with the combined field of medicine and with the symptoms that are more pronounced on the skin and other parts of the body, we diagnose it more often. The dermatology department or the skin departments diagnose it more often than the rest. And also, there are other changes that can happen only to the skin and other parts of the body without any menstrual irregularities. Therefore, in 2018, the criteria for diagnosis of PCOD have been completely changed. It is not the endocrinal symptoms or the medical or the diagnostic tests that we rely on, but we rely more on the clinical aspects of the syndrome. The clinical aspects mainly involve skin, hair, and body, and also the menstrual irregularities. Therefore, if a woman walks in, most of the time, if you see a woman who's slightly obese and also has some kind of an irregular hair growth on the hair, on the skin of the face, also there is a little bit of hair loss or very pronounced hair loss leading to baldness, the diagnosis is clinching, and we say that they suffer from PCOS. So PCOS is an amalgamation of many symptoms, and many other areas are involved. Now, what is the mechanism of PCOS? PCOS is basically an endocrine disorder. It is a disturbance in the hormones. At the puberty, the hypothalamo-pituitary axis is disturbed. So then these people, there is an overproduction of estrogens and coupled with androgens. So these two have antagonizing effects on the body. Estrogens play a major part in increasing the body weight. Therefore, they can be overweight or obese. And these androgens have other effects on the skin, just like increasing the hair, also increasing the corticosteroids sometimes. So there is a flooding of other hormones, and then they cause irregular menstrual cycles, or they can also cause very much irregular patchy areas on the skin, thickening of the skin, dark patchy areas over the face or the neck, or nape of the neck, or on the truncal aspects, or even on the uh, all over the skin or the creases. The basic problem is not only the androgens, but there is also an insulin overproduction. And insulin overproduction is supposed to be the cause for an insulin resistance. The body does not react to the insulin that has been produced, and therefore the effects of a mild diabetes like effects. Most of these people are also prone for type 2 type of diabetes, and when the women conceive also, they have problems like gestational diabetes. So taking into concern, it's a lifestyle disease. So there are modifications which will be surrounding these type of problems. So, so whenever we see a women with polycystic syndrome, we have to be careful that the long-term diagnosis and doctor prognosis has to be good. So the aspects that we have to consider when we are treating the skin are many. Most of the time, the women may walk with a slightly darkened in the area the neck, or the armpits, or the creases. This is called dermatosis nigrans, and this can be treated with strict control of insulin, the changes in the diet, and tablet like zinc can help a lot because the zinc metabolism is helpful in insulin resistance. Once the insulin resistance is tackled, these changes can be reversible. Most of the time, there is a panic in the women, especially when there's other changes like acne and hair loss. But I assure you that many times this is reversible. So the strict control of insulin is the most important point here, and this can happen not only with medication but with lifestyle change. I'll come back to what are the lifestyle changes that are involved here. The other common symptom that people approach us because it's psychologically that is hypnotism. Facial hair can increase. This can be a direct opposition to the androgens that are circulating in the uh, body. So medications are also useful in such type of hirsutism. Then there's a laser hair removal, which is very helpful and which is quick and builds the confidence, boosts their confidence in few minutes. Of course, going to take a few sessions. It's going to be a budding treatment. Also, the internal metabolism has to be changed so that they get a definitive answer. Therefore, OC pills are also started sometimes to decrease the hair loss on the face and other parts of the body. So once the hair reduction along the lifestyle, the periods all can be resolved. Then there is also other symptoms called acne that is mostly it can happen during the puberty, which is very common and is already with a normal growing stage. Most of the time, the acne occurs mostly on the lower parts of the jawline, lower parts of the face. Many types of acne can also come like this. Yeah, they can come as a bigger pimples or a scarring of acne. So this is most devastating, and they have to be tackled at a very young in that age. So they may involve certain types of pills, again certain types of medications, and it also is actually shown because of the insulin resistance. Therefore, again the root cause has to be tackled. Sometimes we also give retinoids to people, oral retinoids, or sometimes androgen as well, very rarely. But diet restriction application will go long in helping to reduce the acne. There is also hair loss. Initially, most people complain of hair which is very diffuse, and this mimics the telogen effluent that we often see because of nutritional deficiency. Therefore, nutritional and diet changes are again essential in hair loss treatment. Apart from that, we see a female pattern hair loss, androgenetic alopecia in women. This occurs mainly in the mid part of the hair. Most of the middle part of the hair is lost, and there's a receding hairline. This is more disturbing and can become more permanent because androgenetic hair loss can cause permanent changes. So this has to be tackled very fast. Again, medications are very important. Unfortunately, we cannot introduce most of the minoxidil because it can create facial hair for women. Therefore, it has to be tackled with other means like giving nutritional supplementation or PRP, growth factors, or rarely we may have to do a transplant, hair transplant. Most of the times, there is also a treatment called Regenera, which is stimulating the hair follicle. and this helps a lot in this kind of female pattern baldness. There are other changes because of the androgen excess, especially because there's increase in the sebum secretion. They complain of more oily skin and very dark patches around the mouth and around the nose. This is a result of seborrheic dermatitis. So this also can be tackled with salicylic acids, diet, and nutrition. The scalp also has increased secretion in the so this results in the scaliness of the hair, and they always complain of dandruff. This is not dandruff, but this is scalp dermatitis or dermatitis. So most of it has to be tackled with supplementation, a good shampoos, and clearing with mild creams also. Sometimes need for sunroom. Along with this, all along, there should be stress or nutrition support. Yeah. So these are the main changes that we encounter in PCOS. And along with this, because of the obesity, we also encounter smaller problems like skin warts, skin tag, because of the increased sweating of the skin and remaining in the skin folds. Likewise, there are also many times fungal infections which are very resistant to treatment. So insulin resistance has to be tackled. The management part includes insulin resistance has to be tackled. Diet and nutrition has to be taken care of. Lifestyle modification in the form of exercises and diet are the most important. Some of the nutritional enzymatic medications are very useful, especially the niacinamide, INH, can be useful for people who want to conceive and who don't want to go on contraceptive pills. Therefore, it's a multidisciplinary action that is needed, and it has to be combinedly worked by the dermatologist and gynecologist to get an overall change. It is not at all disheartening. Therefore, women have to take the responsibility of their health and continue the advice given by their doctors. It is possible. We have seen many people who have been successfully treated and who are living good life with good changes and also the other parts of the body. More than that, if a woman of more than 30 years also has the same symptoms as PCOD, most of the time women confuse this as PCOD. Therefore, they have to go into other aspects of the disease and treat accordingly. Mostly, this is a syndrome of young women. Therefore, should not be confused with obesity in other women. So it can continue as obesity if needed steps are not taken at an earlier stage. Therefore, the earlier we diagnose or self-diagnosed by the client itself, they have to approach for the treatment to improve their self-confidence, to improve the diet and the nutrition and the overall health. So we not take PCOS as a common problem. Everybody has it. So what if I have it? No, no. You have to take care of your health as soon as possible and become an educator for many others. So thanking you all. For more information, you can contact me on Modern Aesthetic, and we have the treatments that are necessary for this kind of diseases. Thank you so much.